So let's talk about how often you should come for acupuncture treatment. It's the most common question, the most misunderstood thing, and often the most undercommunicated thing. So if you've been to therapy, good therapy that's really helped you, and you've understood how those tools have served your life, and you can take them and you can move on with them, right? They're tools in your tool chest. It means you invested time in therapy, right? Because it's a journey. You unveil things, you unravel things, and you become a healthier person. Very similar to what you're doing with someone who works in Chinese medicine. It could just be someone who practices acupuncture. In other words, that's pretty much what they do. They look at the body in terms of channels, meridians, layers and levels, and they do needles. Or it could be someone that you work with in a more holistic way where you're also incorporating herbs or diet or lifestyle or all of those things, meditation, breath, needles. That's what most practitioners are going to be doing. That's what I do. It's a whole approach. So you want to look at it like therapy. And when you start therapy, you typically, the prescription is to go for once a week for as long as that takes. Generally, the smallest amount of time, if you had like a problem, an acute problem to solve, would be 3 months. From there, you want to do 6 months to a year, maybe 3 years. For some people, maybe even 5 years. But hopefully, as time goes, you can come less and less because you are gaining more strength and skills as you go. But the idea is to be trained with how to understand your body, how to listen to your body, how to maintain your body, what it feels like when your body is in balance, and talking about these things with a practitioner. So if you really want to learn that way, you want to find someone who it takes time to treat you. They're going to cost a little bit more, or you're going to need insurance to pay for it, but it's going to be worth it because you're going to walk out of there with an education, right? This is someone with a master's degree or greater who is working at a mastery level in a medicine that has so much to offer. So it's an investment in your own education and in your own health. Now, if you have a broken bone or you have some other acute illness, then a course of treatment is generally going to be anywhere from, it could only be one treatment depending, but I would say anywhere that's reasonable from 6 treatments all the way up to maybe 15 treatments, maybe with in between being about 10 treatments. So that would be like a break or a strain or some other kind of traumatic injury. And you might need to be coming more than just once a week. You might need to be doing 2 or 3 times a week if that practitioner can do it. Also, if you're getting advice from Western medical doctors or not getting advice or feedback about a condition, someone in holistic medicine can really supplement that. Western practitioners don't learn about holistic approaches. They don't understand how the body works as a whole, as a complete unit. They learn it in parts and pieces, which is very helpful and useful in its own way. And they also don't really know much about dietary things, herbal things. A lot of practitioners now use supplements. So lots of different ways you can use that knowledge to help support and back up anything else you're doing, surgery or other treatments. Hope it helps.